When your water breaks during pregnancy, it can feel like the calm before a storm. The excitement of impending labor is often overshadowed by a sudden rush of concern. What happens next? It's not just about the start of labor, it's about the risks that come with it. You may wonder how to navigate this critical moment without falling prey to confusion and fear. Let's dive into what it means when your water breaks, the risks involved, and the steps you should take to ensure a safe delivery. The basics. What does water breaking mean? When we talk about a pregnant person's water breaking, we're referring to the rupture of the amniotic sac, the protective bubble filled with fluid that has been safeguarding the baby throughout the pregnancy. This fluid acts like a cushion, absorbing shocks and maintaining a stable environment for the fetus. Once the sac ruptures, that protective barrier is gone, and it sets off a series of events that can lead to labor but also increases the risk of infection. Understanding the signs. Is it really your water? You might notice fluid leaking from your vagina, and it can be confusing. Is it amniotic fluid, urine, or something else entirely? Here are some key differences to help you distinguish between them. Urine, typically yellow and has a strong ammonia smell. Vaginal discharge, may be milky white and has a mucus-like consistency. Amniotic fluid, generally clear or pale yellow, and it's odorless or has a sweet smell. If you find yourself wondering whether it's your water breaking, the safest course of action is to contact your healthcare provider immediately. The urgency of action. Time is of the essence. Once your water breaks, you might think you have plenty of time. But here's the truth, the longer you wait, the higher the risk of infection. Infections like chorioamnionitis and sepsis can pose serious threats to both you and your baby. This is why healthcare professionals generally recommend that if labor doesn't start naturally within 24 hours after your water breaks, it's time to induce labor. It's essential to seek medical attention sooner rather than later. If you don't start experiencing contractions or any signs of labor within a few hours, don't hesitate to reach out to your doctor. Understanding risks, chorioamnionitis and sepsis. The amniotic sac is your baby's protective layer. When it ruptures, it's like opening the door to an uninvited guest. Bacteria can enter. Chorioamnionitis is an infection of the amniotic fluid, and it can lead to serious complications for both mother and baby, including premature birth and sepsis, a life-threatening body-wide response to infection. Sepsis occurs when the body's response to infection damages its own tissues. The symptoms can be vague at first: fever, increased heart rate, or unusual pain, but they can escalate quickly. That's why early detection and intervention are crucial. What to do if your water breaks, a step-by-step guide. 1. Stay calm and assess the situation. Take a moment to breathe. While the situation may feel urgent, staying calm will help you make informed decisions. 2. Contact your OB/GYN. If you believe your water has broken, give your healthcare provider a call. They can provide specific guidance based on your individual situation. 3. Observe the fluid. Note the color and odor of the fluid. Clear is good, brown or green can be a sign of meconium in the amniotic fluid, which needs immediate attention. 4. Monitor signs of labor. Pay attention to your body. If contractions start, track their frequency and intensity. If they don't begin within several hours, let your doctor know. 5. Prepare to go to the hospital. Pack your hospital bag, ensuring you have everything you need for labor and delivery. Labor induction, what you need to know. If labor doesn't start on its own, your doctor may discuss inducing labor. This process can involve a couple of methods. Medications. Hormones like prostaglandins and oxytocin can be administered to help jumpstart contractions. Prostaglandins help ripen the cervix, while oxytocin, often referred to as the love hormone, encourages contractions. Devices. In some cases, doctors may use devices such as laminaria or catheters with balloons to help open the cervix. Remember, Induced labor can last anywhere from a few hours to several days, just like natural labor. Expectant management, waiting it out. In some cases, your doctor might recommend a strategy called expectant management. This means waiting a little while to see if labor starts on its own. If you're healthy and there are no signs of infection, this approach might be appropriate. Guidelines from the American College of Obstetricians and Gynecologists, ACOG, suggest that if your water breaks after 37 weeks and you're low risk, it's generally safe to wait 12 to 24 hours. During this time, your healthcare team will monitor you closely for any signs of infection or distress. Know when to go to the hospital. While waiting can be an option, certain scenarios necessitate immediate medical attention. If you're less than 37 weeks pregnant. If you have a history of rapid labor. If you have Group B streptococcus, GBS, or are unsure if you have it. If you experience intense pain or heavy bleeding. Trust your instincts. If something doesn't feel right, don't hesitate to seek help. Conclusion: empower yourself with knowledge. Knowledge is your best ally during this critical time. When your water breaks, the clock starts ticking, but being informed can help you navigate the next steps with confidence. Remember, the healthcare team is there to support you every step of the way, but your awareness and proactive approach can make a world of difference. Understanding what to expect when your water breaks and what actions to take can not only enhance your experience but also safeguard your health and that of your baby. Don't let fear control your journey. Embrace this incredible moment with knowledge, and prepare for the beautiful adventure ahead.